Being the resource that breaks the circle, oftentimes the first step here at our emergency departments catalyzes a long string of events to follow, and it requires the collaboration and partnerships across our community. By working together, Empowerhouse, Stafford Hospital teams, law enforcement, and community partners, we create a network that supports not only the immediate needs of our survivors, but their long-term well-being.
What does it mean to be a domestic violence prosecutor? Well, first of all, let me talk to you about what it means to be a prosecutor. The police have arrested an individual and they're charged with having committed a crime. Many times there's a victim of that crime, and as a prosecutor we meet the victim and they cooperate with us to make sure that justice is done and the offender is held accountable. That's what happens in most of our cases. The dynamic for domestic violence is so different from that, because the dynamics of domestic violence are like no other crime. You have victims that, for whatever reason, are not cooperative. They don't want to come to court. They don't want to speak to the prosecutor. They don't want to have the offender accountable. They don't want to help. I've seen victims that are so scared about what's going to happen to them simply because the offender got arrested. I've had victims that want to see their offender, their abuser, held accountable. And so we have a full range in domestic violence cases and prosecutions of types of victims. They all want different things, but they all want the same thing. They want it never to happen again. And it's our job, to the extent that we can, to help reach that goal.
Today we come together not only to recognize those survivors and those who courageously support them, but to reaffirm our commitment to providing compassionate, effective support in these critical moments. At Mary Washington Healthcare and here at Stafford Hospital, we view ourselves as integral community resources. Our emergency departments are often the first place where survivors come for help, sometimes even before disclosing their situation to anyone else. For many, this visit is the first point of care and a crucial step towards safety and healing. It is why we incorporate intimate partner violence screenings into our triage and bedside routines. This approach allows us to provide more than medical care. It opens a door to resources, advocacy, and hope. We are grateful for our partnership with Empowerhouse, whose advocates work directly with our emergency department to support survivors at the bedside. 24 hours a day, 7 days a week, Empowerhouse is available. Empowerhouse and our teams often work in tandem with local law enforcement to offer survivors the immediate support, safety planning, and resources they need. We know that for each encounter, each step taken can empower someone to begin the journey toward safety and reclaim their life. Intimate partner violence has a profound impact on survivors' physical and mental health. It can lead to chronic health issues as well as increased risk of PTSD, depression, and other mental health challenges. Today, we acknowledge that healthcare's role is essential, but definitely not standalone.
We need the wisdom not to judge. That's very important as a domestic violence prosecutor. We need the ability to educate the public so that the public understands domestic violence in a way that we understand it, so that they don't judge. We need the resources to help. And I'm so proud to see Team Stafford here today. It starts with our sheriff's office, one of the best in the state. We partner with the sheriff's office very closely these amazing Board of Supervisors that give us the support and the resources we need, our county administrator and assistant county administrator, we could not do it without you. It is all the time working together to reach that goal, provide the resources to intervene. What does that mean? Different cases, it's different types of intervention. As a domestic violence prosecutor, you have very little time because you have a heavy docket. You've got 20 cases on the docket, and you have just a little time to meet with and connect to with that domestic violence victim. But if you show them you are not judging, if you show them that you want to get to the same place that they want to get to, that not to have it happen again, if you show them that you care, and if you show them that you're not the enemy, that you're there to help to the extent that you can, you have made the biggest impact as a prosecutor that you can in a domestic violence case.